name is Karina Timmermans. I was with McKenna Koima and Abby Betch, and we did sickle cell anemia. First, let's look at what sickle cell anemia is. Sickle cell anemia is one of a group of disorders known as sickle cell disease. Sickle cell anemia is an inherited red blood cell disorder in which there aren't enough healthy red blood cells to carry oxygen throughout your body. Normally, the flexible round red blood cells move easily through blood vessels. However, in sickle cell anemia, the red blood cells are shaped like sickles or crescent moons. These rigid, sticky cells can get stuck in small blood vessels, which can slow or block blood flow and oxygen to parts of your body. There's no cure for most people with sickle cell anemia, but treatments can relieve pain and help prevent complications associated with this disease. Signs and symptoms of sickle cell anemia usually appear around 5 months of age. They vary from person to person and change over time. Signs and symptoms can include anemia, episodes of pain in joints or bones, swelling of hands and feet, yellow skin or eyes, frequent infections, delayed growth or puberty, and vision problems. To assess sickle cell anemia, we first will need a history of lung infections and hypertrophy of the heart. Next, we will do a physical exam to look at growth curves in height or weight, which happen usually around age 7. We will also look at the color of the skin to see if it is yellow or pale. Finally, we will do a psychosocial to discuss potential coping skills and psychological counseling. Sickle cell anemia is caused by a mutation in a gene that tells your body to make the iron-rich compound that makes blood red and enables red blood cells to carry oxygen from your lungs throughout your body. In sickle cell anemia, the abnormal hemoglobin causes red blood cells to become rigid, sticky, and misshapen. Both mother and father must pass the defective form of the gene for a child to be affected. If only one parent passes the sickle cell gene to the child, that child will have the trait. With one normal hemoglobin gene and one defective form of the gene, people with the sickle cell trait make both normal hemoglobin and sickle cell hemoglobin. Their blood might contain some sickle cells, but they generally don't have symptoms. They are carriers of the disease, however, they can pass this gene to their children. To diagnose this, we will start with a blood test. This will help us check for the defective form of hemoglobin that underlies sickle cell anemia. In the United States, this blood test is a part of routine for newborn screenings. However, we can definitely still test this at your age. To do this, we will draw a blood sample from a vein in your arm. Then the sample will be sent to a laboratory where it will be screened for the defective hemoglobin. If the screening test comes back negative, then there is no sickle cell gene present. If the test comes back positive, further tests may be done to determine whether 1 or 2 sickle cell genes are present. If we find that you have sickle cell anemia, your doctor might also suggest additional tests to check for possible complications of this disease. Also, if we find that you carry the sickle cell gene, you will likely be referred to a genetic counselor. There are many options available for treating sickle cell anemia. Treatment options can include medications. You can see multiple medications that doctors may prescribe for you on the screen. Almost all of these aid in reducing the frequency of pain that may come along with this disease. We will also work to prevent infections and make sure you receive all the recommended vaccinations against pneumonia, meningitis, and also the annual flu shot. Another treatment option could be a blood transfusion. In a red blood cell transfusion, red blood cells would be removed from a supply of donated blood and in return given to you through a vein. This will increase the number of normal red blood cells, which will help reduce your symptoms and pain. Risks of a blood transfusion could include an immune response to the donor blood, which could make it hard to find future donors. It could also lead to infections and excess iron buildup in your body, which could cause damage to your heart and liver. Therefore, if you undergo regular blood transfusions, you may need treatment to reduce your iron levels. The last treatment option is a stem cell transplant. With this procedure, we would replace your bone marrow that is affected by sickle cell anemia. We would replace it with healthy bone marrow from a donor. The procedure usually uses a matched donor, such as your sibling who does not have sickle cell anemia. Because of the risks associated with a bone marrow transplant, the procedure is recommended only for people who have significant symptoms and complications of this disease. The procedure ultimately requires a long hospital stay afterwards, and you would receive drugs to help prevent rejection of the donated stem cells. Even with that, your body may still reject the transplant, which could lead to life-threatening complications. Overall, we will work with you to find the best possible treatment plan that is right for you. Sickle cell anemia is a disease that worsens over time. Therefore, people who have it have a reduced life expectancy. Some people with the disease can remain without symptoms for years, while others do not survive beyond infancy. Treatments are available that can prevent complications and lengthen the lives of those who are affected by it. Long-term follow-up is required for patients with sickle cell anemia. The frequency of outpatient visits depends on the patient's clinical status. For patients with minimal symptoms, a visit with blood work for every 3 to 4 months is reasonable. If you have any questions, feel free to ask.